Today, we're going to talk about the ESENeph examination, and it's just going to be very casual. So anytime that you guys want to ask anything, just shout. And because it's casual, I did not make a PowerPoint slide. What I did was just put a lot of thoughts down on Microsoft OneNote, which I will share just now. Okay, can you let me know whether you can see the screen?
Yeah.
Okay, I see Robbie nodding. Lovely. Okay, so essentially this is going to be split roughly into 6 bits. So I'm just going to give you an intro, talk about the marks, talk about the kind of layout of the exam, and then I'll be telling you about resources that I think we should do, and then talk about pathology, how to find out more resources about to sort of tackle the pathology side of things. We'll talk about question banks that I think is essential, and then we'll go through some ESENeph questions. So, okay, so the very first bit is this certificate over here. Can you guys see it? So this is the certificate that I am wishing upon you guys to receive. It's this certificate that tells you that's got these various tags on it, signed by various people, and basically this is what you get. Essentially, what I want to show you here is number one. Number of questions is 200, and you got pass mark here. I think it's kind of like a weighted kind of scoring thing, and I have no idea what the total mark is. I know what the pass mark is, but I have no idea what the total mark is. I hope that you guys will get this eventually, and like me, when getting it, I was yelling like a strangled chicken, and hopefully you guys will get there. Now I'll put this up here because this is what the end result hopefully is. But what I didn't tell you guys, what many of you may not know, is that technical error is that I actually got this one. So I actually had attempted the exam twice. And so when I was in ST4, when I 6 months into ST4, I decided why not I just give the exam a bash. And give me a second, I think someone's trying to join. No. Okay. I thought, why not give the exam a bash and see what happens? And so that's what I did. So in SE4, I did that, and you can see there I failed by quite a few points. And then I retried again the second time 2 years later, and that's when I passed. So I guess that comes to I put this up just to explain why I want to give this session. Is because I think all of us at this point in time when we fail, it's not because of our ability, it's just because of the resources that we use. So people fail when they use the wrong resources, and it's certainly what happened to me when I failed the first time. I was not using the right resources. And the second time, when I was a bit clever about it, or people told me a bit more about what I should be using, that's when I passed. So the point of this is to point out all the right resources for you to use. And I think in the previous kind of sessions where I've attended or various exam talks, when they say, "Oh, I'll give you a talk on the exams," I never found it helpful when they said, "Here are 5 textbooks for you to read. Go read all of them." I think that's bloody unhelpful. I think it'd be more helpful if someone just said, "Here are the resources that you read. You must read all of them. Not choose one of 5 textbooks or 2 or 5 textbooks." I find it very unhelpful. So today I'm going to tell you specifically what to read and what not to read. Now, the second thing that I want to talk about is when to do the exam. So, as I said, I did the exam in ST4, thinking that the earlier I do it, the better. But actually, having done the exam now twice, I think the best time to do the exam is as late as possible. So don't try to rush the exam. The later you leave the exam, the easier your preparation is. And the exam is one of those exams where renal exam is one of those where you either know or you don't. It's not something that you can derive. It's kind of like the Ponticelli regime. Like, if you know it, you know it. If you've treated 3 patients and actually gone through the Ponticelli regime before, you will know it in your head. But if you've never seen it before, you try to brute force memorize it, it's going to be so difficult. And all the regimes in renal are unfortunately, people pluck numbers out of the air. Let's give this for 10 weeks. Let's give this for a couple of weeks, and they try in a trial, and the trial shows yes some benefit, and it goes into the guidelines. And so it's not something that you can derive. It's something that you can only get with experience. So, but my second point here is that if you can, try to leave it as late as possible. Don't do what I did, where I did it too early, and it was very, very painful. Like I like trying to memorize all these regimes, and and trying to learn about the pathophysiology at the same time was incredibly painful, and I would not recommend it. So if you can, that's kind of the advice that I would throw out. But I know that different people have different kind of life circumstances where they, they want to finish this before they start certain life events and things like that. So, by all means, do it on your own time. But if you find that your colleagues are doing it earlier than usual or earlier than you, don't fret. Just take your time, and the later you wait, the easier your exam preparation is. So, remind me, who's taking an exam in a couple of months' time? Rob, Gregor, two of you?
I am as well, sir.
Oh, sorry, I couldn't see. Sorry, gotcha. So three of you. Okay. Fine. So, now that that's out of the way, let's look at the nephrology blueprint, and this is available on the ESENeph website. Have you guys seen this? No. Okay. So this basically tells you the layout of the exam. So in the exam, there's 200 questions, and they are split according to these numbers here. So the topics. So this is really the Bible, kind of what you need to study based on, and it is quite prescriptive. So glomerulonephritis, etc. You can read it. I'm not going to read down the list, but what I do want to point out is the distribution of questions. So you see, GN, there's 30 questions. It's 15% of the exam, so quite a big bulk. And then you've got fluid and disorders, 26%. A small weightage is 8%. Okay, and then the other bit here I want to point out is others. Others is 24 questions, so there's about a bit more than 10% of the exam. And the others consist of all these topics here in the bottom. Can you see that? So therapeutics, pregnancy, nutrition, end of life care, etc. So this, I want to point out the third thing here is the third point of this is I want to point out this, and you need to, it's good to keep an eye on this so that you can sort of structure your proportion that you're spending on a topic. Like if you're spending 80% of your time doing PD and 20% of your time doing GN, then you're not really doing it right, if that makes sense. Okay, and now the next bit I'm going to do is I'm going to go through each one, and I'm going to point out resources that you have to do, or rather that I did that helped me get over the past one. So the first thing we're going to talk about is GN stuff. And unfortunately, what you have to do is, see if you can scroll over here. And you have to go on the KDIGO guidelines. You have to go on KDIGO guidelines. And the ones in blue, the ones that circled in blue are the GN ones that you have to look through them. There's no two ways about it. You just got to go through the guidelines. And one thing I want to point out as well is that the ESENeph is a clinical exam. It's not a kind of pathophysiology science-based exam. So if you were like me, when the first exam, when I was studying for it, I was focusing a lot on pathophysiology. What were the channels in the principal cell? What were the channels in the proximal cell? And what does furosemide do to loop of Henle? What channel that it affects? You can study that. If you're like me, where you need to understand things from first principles in order to remember things, then you have to allocate extra time to study that. But the exam will not touch on pathophysiology stuff. It will touch on all clinical things. So don't spend too much time trying to memorize that one channel that does what. you're better off, if you have limited time, focusing your time on the guidelines. Because again, this is a clinical exam. Okay. So these in blue are things that I would fully recommend. Now, again, these are guidelines. They just tell you to do things. Like, do this if it's this. If it's this, do that. But it doesn't really explain to you how the kind of nuances of the disease, like kind of what the rationale behind it. And this comes to my next resource. I would really, really recommend you to to read this a what I call it textbook. It's kind of is Nephro Shots essentially is the name of the book, and it's written by a nephrologist in London, and his tag is the peanut kidney, and he's got I think 4 books when I last saw it, and it's high yield and specific for the specialty for the ESENeph. And this book is amazing because not only, let me show you the content page. So these are the content page. I just took a photo of it. So this, I think, is book 1. This is book 2. This is book 3. So you see, book 1 is a lot of lupus, small vessel vasculitis, and book 3 there's a lot more on nephrotic syndrome type things over here. You can see minimal change FSGS. Book 2 has a bit more sort of hematuria type of kind of pathology. Let me zoom in so that you can actually see it better. Sorry. Can you guys see it?
Yeah.
And then book 4 is all your electrolyte stuff. And not only, and his questions are really good. So he does it in a question-based form. Let me give you an example. So this is one from one of the books. So see, this is question 14 talking about, you can see it, it's microscopic hematuria and blood pressure was this is the blood work. What's the best cause of action? And you basically have, and then what it does is that it goes through the answers and it goes through the rationale for each of them. And what I found was very helpful with this is that it explained the rationale of the disease. It explains the pathophysiology of the disease very, very well. And I find that I never really could find a consultant or anyone in the in renal unit to explain to me exactly what membranous is, what exactly is IgA, how does it occur, that kind of thing, like the nuances of it. And this book does that. So if you're like me, where you need to understand things in order to for it to internalize from first-base principles as you can get, this is the book that you should read. And I really, really highly recommend. I wouldn't recommend any other textbook, if you call it a textbook, any other book apart from this. So that is a quick segue into Nephro Shots. So I really recommend that resource. The second thing is then going down the topic. So 26 questions, also a very big topic, is acute kidney injury, electrolyte and acid base. And I already alluded to Nephro Shots being an amazing book. If you read this book, you pretty much don't have to read anything else if you read that. And the other one as well is go back to KDIGO and again, acute kidney injuries here. And you need to read the guideline. So going down CKD, 24 questions, also a big chunk. Again, KDIGO also has a big has one there, CKD evaluation management. So again, you have to read that. And again, Nephro Shots covers a large proportion of it as well. Continue. Cool. So when it comes to the bulk, so we're talking about how many questions is this? So 70, 50, 80 questions, 80 out of 200 questions. So almost half of the questions. If you read Nephro Shots books, and these are quite high yield stuff, so it's not like a thick textbook. It's actually quite thin. I got mine in Kindle form, so I don't know actually physically how big it is, but it's all very small print and all like Kindle size. And it's not long. It's not a huge textbook. It's just pretty punchy. you study that and you study the guidelines, you cover almost half of your curriculum. Cool. Any questions about that? Okay, so moving down, so renal bone disease and renal anemia, again, KDIGO guidelines. So anemia and CKD, renal bone disease. You just need to read that. You'd be surprised, CKD, renal bone disease, when I read it, there wasn't actually much that was in there that was that helpful. It's kind of a bit waffly. But anyway, it's one of those things that you have to read. Yeah, Anna, go ahead. Your hands up.
Sorry, so I haven't obviously read the KDIGO guidelines on any of these things. That's just how I roll, I guess. But see, just on that last point, you're talking about renal bone disease, renal anemia, and referring to the KDIGO guidelines for that. So I guess what I'm wondering is, are these questions about interpretation of biochemical tests? Are they asking you for recommendations of what sorts of medications you'd be prescribing if you're presented with a certain patient? I'm just trying to grasp that because it seems quite physiology based, and it's.
So actually in the last bit there, I think got 2 or 3 questions that I kind of remembered from the exam that I will go through as well. But essentially it's kind of like, this is the patient's hematinics. What would you do next? Would you give EPO? Would you start EPO? Would you give ferritin? Would you give Ferinject? Would you would you give folate? That kind of thing. So it's from memory, I think they gave you a blood panel and they gave you the hemoglobin and they ask you what to do next. So again, it's quite clinical. It's kind of like these are the results. What do you do next? This is the calcium, this is the phosphate, this is the PTH. What would you do next? Sinocalcid, would you give alpha calcidol? Would you have parathyroidectomy, that kind of thing. So again, it's quite clinical. But we'll go, I think I've got 2 or 3 questions that I have at the end there, which we'll go through. Does that kind of answer your question for now? I've not fully answered your question, but then we'll go through it. But I think one thing I do want us to highlight is that if it's in KDIGO guidelines, it is fair game, and we will pull things from that to put in the exam. So essentially, that's just basically what I want to highlight, the KDIGO guidelines. Now, I know you said that you didn't, like Anand, you said that you didn't read the KDIGO guidelines. Don't fret, because a lot of our of the guidelines that is on the clinical GGC portal is also derived from the KDIGO guidelines. If you look at our GGC kind of Glasgow portals, you look at the bottom of the references, all pulled from KDIGO. So it's, if you read that, our GGC Glasgow portal, you more or less covered the main points that are in the guidelines. It's just that I just want to highlight that the KDIGO guidelines is something that all these guidelines you have to at least glance at once. Cool. So cardiovascular disease, hypertension, renal vascular, and diabetes. So again, diabetes, big topic, and it's all here, all in green. Diabetes, blood pressure, and lipids. It's all there on KDIGO. So again, it's fair game, and they will come up questions based on that. So then we come to the bits which is a little bit harder to find resources. So the first kind of 5 bits here, there are pretty robust resources that are out there. The other few bits, a little less kind of resources that I can sort of say do this. But it's so urology presentations, renal stone disease, urinary tract infections, and obstruction. That one, I think I used. There was a presentation. I was going to find this presentation. I think I found a presentation on YouTube that was extremely good, talking about a stone. Sorry, I'm just about stones, which is a good segue to one of the resources that I've used a lot is YouTube. There's a lot of very, very good YouTube resources that you do not look down on when you are on your way to work, on your car or whatever. Put it on and just have a listen. And I've learned so much by just passively listening on YouTube, particularly these areas that there's no specific guideline for. So I've got a blue line here, and that is pointing to to UKidney. So this is the other thing that this is the other website that's been pretty helpful. So UKidney, and the website's over here. They've got kidney stone prevention and kidney stone prevention, obviously. So these are kind of I think these are pretty good resources. I didn't actually use them. Full disclosure, I think the resources that I used were fully just on YouTube. I didn't use any other kind of resources. These are resources that I found later on. I've not actually looked into them in detail, but I just found them. And I thought I'll put them in there because it's kidney fair game UKidney, and it seems silly to not put it. So that's one resource that you can use. Now, inherited and rare disease. This one was really annoying. So 14 questions. So there's quite a few questions. When I'm doing it, I'm like, oh, there's another inherited question. There's another genetic question. And then after a few questions, oh, another one. It just felt like there was... It's a bit annoying. It's one of my Achilles tendons because it's one of those you just got to memorize. Now, there is a lecture done by Tara a couple of years ago that is somewhere on the team's kind of saved videos that was good, but I don't think was fully comprehensive enough. A lot of what I learned from inherited diseases was again on YouTube. You just go on YouTube, inherited renal diseases. There's at least 4 or 5 very good lectures that come up, sort of the first 5, or first 6 that are really, really good. And so again, you kind of have to think kind of a bit out of the box with YouTube and trying to find different resources for these kind of topics. There is when I was doing it, people were recommending that I go on RADAR. I can't remember what it stands for, but it's a database for rare renal genetic diseases. I've never actually accessed it myself, but 2 or 3 people had mentioned it to me before. And when I was doing this thing, I kind of looked it up, and the database is there. I don't know how the layout is and how useful it is in terms of studying, and I don't know whether you need a login. But I thought I'll just put it there in case in case one of you has got a login and is able to tell me that is incredibly useful for the exam. I've never used it myself. I'll just put it there, so hence the 3 question marks. Okay, so that's inherited and rare diseases, 14 questions. Caitlin, do you have a question?
Yeah, I don't know how about accessing RADAR itself, but there are a few papers from the RADAR cohort that might be useful, just with some of the epidemiology and outcomes of some of these rare diseases. So I know they've definitely got an IGA paper in Lancet, so maybe searching for their kind of key outputs might be a more useful resource rather than kind of actually the data itself.
Also, you mean RADAR has so I'm understanding you right. So RADAR has published a few papers that are...
I'll find an example to talk about. I know there's an IgA nephropathy one, for example, which just kind of characterises epidemiology and outcomes. It's the UK cohorts, but I think it's probably all fairly generalised.
Okay.
That might be the usefulness of RADAR rather than the actual raw data, which we need permission obviously to.
Oh, I see. Gotcha. Yeah, so that would be useful. Thank you, Caitlin. That's very helpful. Keep in mind that the ESENeph is a European examination, so it covers its examination for the whole of Europe. So, and the questions they ask has to be applicable to the UK population as well as whatever population that's in Europe. So, if it's a question that is kind of not fair game per se, they shouldn't put it in. Or if they put it in, they might actually sometimes on all the exams of the 200 questions, they sometimes remove 1 or 2. They might remove the question. As in, what I'm trying to say is that look for these resources and don't forget these. When you get one of these papers, it takes a lot of time to read. I just want to point out to be a bit smart about which resource you kind of spend your limited time on, because if you think that this is not going to be, if there's a lot of questions behind it, and people are not very sure, and there's not very clear guidelines or clear agreement throughout at least Europe, then you'll be rest assured that you will not come on the exam, because they can only ask questions that are, everyone agrees like SGLT2, if with this, everyone knows that you have to give for these criteria, then it will definitely be in. But if it's something that's a little bit more niche, then it may not be in. Just to highlight that. But radar, and like what Killian said, if there are papers that are out there, then it's fair game. But just be careful about how you allocate your time, particularly with very niche stuff. Does that make sense? I was waffling there a little. Okay, PD. 8 questions. This is an annoying bit about PD. 8 questions, but you have to go onto ISPD guidelines, and there are a few guidelines that you have to read, and it is quite a lot. I can show you my mind map that I did to try to summarize all this. It's very prescriptive, as in it's good that all that you need to know about PD is on this guideline, all on this page. That's all you need to know. Exercise, and all this prescribing PD and kind of things is all you need to know. But you're doing all that for just 8 questions. It was really annoying. It's helpful that all the resources there, but it's really annoying that I spent so much time to just do 8 to just answer 8 questions. I can show you really quickly actually the PD thing I did. But it is I made these mind maps, and feel free. I'm happy to share them with you. But you see, all that for just 8 questions, and it still continues on here. So it's a lot to go through. But all the resources are there. And again, I'm happy to share this with whoever wants. Some people study. Everyone did studies differently. I studied with. So, okay. Uh-oh. So I think seizing up a little bit. Well, I'm going to stop sharing for a while. It sometimes does this when it's when my CPU is fully overloaded. Any questions at the moment whilst I get it set up?
Yeah, thanks. Can I ask a couple of questions?
Yeah,
Are there any particular YouTube channels that you recommend?
Yeah. I'll go through some YouTube resources in a second, actually. Also because I talk about you, I'll touch again on YouTube. Remind me again if I don't touch on it, Chris. When I'm talking about the pathology side of things, I'll talk about YouTube.
Okay, cool. And then, did you listen to any podcasts? Any useful renal podcasts that you used, for example?
I didn't. There was no podcast that I found that was kind of high yield enough. I mean, there's like NephJC and things like that, which were a bit more nephrology specific, but they weren't exam specific. Certainly when I was studying for it, I couldn't really find any dedicated resource, any podcast. That's why I turned to YouTube for specific topics that I didn't find resources for. What I did find, there was an acid base there's an acid base talk that was done by, what's his name? The guy who does NFGC, Joel Toff. You guys know Joel Toff? Heard the name? Yeah. And he did. If you go online and find Joel Toff renal tubular acidosis, he does quite a good 45-minute on renal tubular acidosis. And I remembered from memory, those were the only helpful podcasts that were available. I couldn't really find anything else, which is a bit annoying because, unfortunately, there's no data. If we put our heads together and make one, then and ask people to pay $50 for each, maybe. Nah.
Yeah.
What's the other question?
Oh, well, you might cover this already, but I mean, roughly speaking, it's about 3 to 4 months prep that you need for the exam. And when I say prep, I mean like actual study time.
So your question was, what was the
How long did you spend studying for the exam you
how
passed?
much did I spend studying?
Yeah.
So the second time that I did it, I sort of did bits and pieces over started sort of looking at bits and pieces sort of 6 months before, and that was just really just looking at it. I think slowly looking at nephro shots and just taking my time. And I think the 3 months was when I sort of gave up social life and sort of just really kind of dedicated myself to just doing it.
Cool.
But again, this is kind of my way of doing it, and
Yeah.
I'm probably the least intelligent out of all you guys. I'm least book smart, and so like that's how I did it. But you guys might not need that much time. And again, the longer you wait, the later you do it, the less time you actually need. If you're like me, where I did an ST4 with 6 months, I started studying probably 8 months before the exam time. This was at ST3, so going to ST4. And I started studying that, and I still failed because I was studying the wrong resources. I was studying the principal cell. I was studying, all the really nitty-gritty detail of like what is urine specific gravity, that kind of stupid shenanigans that will never come up in clinical. So I think my point there is that it depends on the later you wait, the less time you need to study for the exam. But on average, I did use a little bit of time because I was not experienced when I took the exam. And now, hopefully, with this, I could focus. You could focus your study on just these resources and not waste time on anything else. Hopefully, that will cut down any extra time that you needed by spending on resources that are not helpful.
Cool. Thanks, mate.
No worries. So hemodialysis. What did I put here? So hemodialysis is sort of, if you have got a dialysis cohort, I think you'll be fine. Let me see. I've got a wee black line. Nope, not helpful. What did I do there? Oh, it's renal transplant, my bad. Hemodialysis, oh yes, that's right. On the GGC protocols, there's that section there that says hemodialysis and all your troubleshooting, like, your patients that had crash all the time on dialysis. What do you do? The various steps that you do, lower the temperature, calcium, whatever. If as long as you got a dialysis cohort, you have a rapid phone, and you look through those protocols, generally your hemodialysis wouldn't be too much of an issue. Again, and keep in mind it's only 14 questions. But this one wasn't much of an issue at all if you got a dialysis cohort. And really, there's no other. I got the that little textbook for dialysis. You know what I'm talking about? The little clinical handbook for dialysis. Never used it. I bought it, and I opened it up, never ever used it. But maybe I should have, but I didn't, and I didn't really find it. Okay. Now renal transplant. Oh, specific guidelines. Tons of them. Not tons of them. That's not a lie. There is guidelines for it. So there is on KDIGO guidelines, living kidney transplant candidate and transplant recipient. You must read all of them. When I was doing it my first time, I was told by a certain consultant that they will never ask questions about transplant candidate. So I didn't study anything about transplant candidate. And I can't remember, I think about 5 or 6 questions came up just on transplant candidate. And I was like, oh, F sake. But essentially, if they are in the guidelines, they are fair game. And please read these 3 guidelines. That's very important. And the good thing about it is once you read these 3 guidelines, you'll be rest assured that that the questions will be based on that. It's not, you don't have to read anything else. You don't have to read any other textbook or anything else. Just read those. Cool. And now we come to other. Now, other is a little bit more mishmashy and not really any specific guidelines that I could point out. Now, renal disorders and therapeutics and safe prescribing, whatever that means. actually, I know what that means. One thing, I told you I did the exam twice. Each time I did the exam, there was one question on live vaccines. You have to know your live vaccines. You'll be this patient is planning to go, has a transplant and is going to go to this country. Which vaccine does she need to take? And you have to know. And the crux of the question is to know which live vaccines, which vaccines are live, and therefore you can't have it. And this is my list. Can you guys see my? I forgot to check that you guys can see my. I'm sharing. Yeah. And I came out with a mnemonic, a very dirty mnemonic, which I'll not share here. You come up with whatever mnemonic you want to make, as long as you can list it out on the day itself on your board. Mine was very dirty, and not safe for work. I'll not share it. But this is the list. You guys can either take a photo of it, or if you have your own kind of list. Cool. I'm gonna scroll away. No one's saying no to scroll. Okay, good. Okay. Then the second one, renal disorders.
Sorry,
Someone
I raised my hand before interrupting.
Go.
Is there a list of the live vaccines anywhere in Kitaiko or anything, or is that just a list you've concocted yourself?
There's a list I concocted, and no, there's no specific list that I could find on Kitaiko actually. It's a list that I sort of cobbled together, a mixture of YouTube and questions and things like that. And I think you can see here, I crossed out rabies because one resource said there was rabies, and I think that's not right. But there's no, yeah. So I cobbled it together.
Okay, cheers.
Kaylin.
Gregor, I wonder if the green book's the place to look at. I haven't looked this up either, but the distant memory of that being the go-to source for vaccine type questions.
Good point. What was that?
The green book? This is the general vaccine thing. I'll give it a Google.
Okay, the green book. Oh, that's a good idea. The green book, yeah. Yep. Cool. So whilst you're googling that, Kaylin, I'm just going to move on to renal disorders in pregnancy. So this one, now the peanut books had something on it that was very, very helpful. Let me see if I can find it. Something about preeclampsia. That's here, preeclampsia, and there's a little section on it on pregnancy. And the other important resource as well to point out for renal disorders in pregnancy is YouTube. You just YouTube renal disorders in pregnancy. I think I listened to the 3 or 4 ones on the top, that were like 45 minutes to 1 hour long. I listened to it on the way to work, and they were very, very good. And I'll highly recommend that. I cannot really find any other specific resources for renal disorders. Infection in renal patient. This is the most random thing. I'll probably cover it. I'll talk about a question about this later on. Active supportive dialysis care. So there's end of life care. There's always one question which is painfully obvious as to what you should do. It's like a patient at 82 and is struggling with dialysis and doesn't want to do it, but the family wants her to keep going. What do you do? There's something like that. It's something really simple. It's only one question that will come up. But you have one question on end of life care. Now, nutrition did come up as well. So the question, again, I'll go through some questions later on, was how much protein does the patient on hemodialysis need to have? So there's a question on that. Again, UKidney, I believe there is a nutrition, there's nutrition stuff on this, on UKidney. I didn't use this, to be honest. Again, this is UKidney is a resource that I found after the exam, but it looks pretty helpful. But yeah, so that, and if you have not enough time to read this, remember, it's probably only going to be 2 or 3 questions. Don't sweat. Okay. Sexual practical procedures. I'll go through some questions about it later on, but that does come up. Cool. So these are the resources. Let me just make sure I've not missed out any other resources. I'll go through questions in a second. Yes. Yes. Next one.
UKidney website has a YouTubeule link.
On
Really tickled me. Lots of nephrology puns.
YouTube. As in, what was that? Was that link for the vaccines or for something else?
On the UKidney page, their tab rather than YouTube, it's YouTubeal.
Us nephrologists are the coolest people ever. Cool. Now, pathology. Unfortunately, there are at least 3 or 4 pathology slides that you have to interpret, and resources were quite scant and had to really cobble together. Here we are. Really cobble together a couple of things. So these are the resources that I use that I will recommend. So first is this YouTube channel called Washington University St. Louis Nephrology Series. They've got, I think, about 8 to 10 lectures there that are really helpful. So IgA nephropathy, and they've got some really interesting some interesting cases that they present, and they basically walk through the kidneys. They walk through the interpretation of it. So they have got this person that created this is a nephrologist, and he often picks up a interesting case and goes through it live with a with a renal pathologist, and often with a student as well. And so the kind of it's very helpful to go through. The way they did it was very helpful because they just basically go through the slides. To go through the laparoscopy, the IF, and the EM. So very helpful, and I think I watched them each of this videos. I think I've watched them like 7 or 8 times because I just over the 2 years, keep in mind I did it twice, did the exam twice, watched it 7 or 8 times, and it was very helpful. But in itself, I don't think it's enough. I think it probably covers like 70% of what you need to know. Now, in terms of and I'll go through in a bit more resources. Now, there is a pathology course by Imperial that is just before the exam, 30 to 31st January. I tried to go on it, but I foolishly didn't apply in the right time. I applied after the deadline. But Wan Wong, he's one of the consultants now in Monklands. So he applied. He went for this course, and he said that 2 of the slides that went through the course went through came up exactly at like the slides where the course came out in the exam. So in terms of if you want to spend £500 or £350, by all means. I think I was going to because I didn't manage to because I missed the deadline. But this is a course that you can take, and probably the only course that I'm going to recommend. Maybe the advanced nephrology course, but I don't know how helpful it was. I did the advanced nephrology course, fucking expensive, ridiculous. But I did remember that it was kind of helpful for when I was studying for SLE. There was a lecture on SLE that was pretty helpful. But is it worth $1,004 when there are a lot of very useful SLE lectures on YouTube? I think that's for you. I don't think it's as useful. I don't think it's good. I don't want to. That's my opinion. Cool. Now the other resource for pathology is ajkd.org. They've got an atlas website going through these, and it's got pathology slides for all these diseases that you see here. So very helpful. It's not as used. The only thing is that it kind of shows you the slides and kind of has some description. You almost want to have someone talk you through it. If 3 of you are meeting up and talk through the slides, it might be helpful for you to. This might be a helpful resource helpful resource to use. And the other one is again UKidney. There is a page. Where is it? There's a page where they go through where they've got a few pathology slides. I think there's only 6. There's not that many. But there's a page in the UKidney that's got pathology slides. So I think with these 3 resources, UKidney, Atlas, as well as this YouTube channel, I think they'll be enough. And then you can top it up with the Imperial course if you want to take it. I think you'll be fine. But these are the resources. It took me ages to find these resources and actually cobble them together. But yeah, these are resources that you should use for pathology. It's really annoying, pathology. When I applied for renal, I didn't know that the exam will have pathology slides. I was like, well, I didn't apply for renal to become a fucking pathologist and read slides. Fucking hell. But anyway, it's an exam. You have like 4 or 5. Okay, question banks. Wow. Oh, we're almost an hour. Sorry, guys. We did start late. So question banks. So questions that I will use. Again, I told you about nephro shots. I would recommend you do all of them. Yeah, I think if you do them, you'll be in very good state to pass them. Okay, so nephro shots, 4 books. And each of them have got like 90 to 20 questions. The questions is one thing, but the explanations behind it that follows the questions are excellent. Have any of you got nephro shots? Raise your hand if you have. And I have. And have you read a bit of them?
Yeah, it's pretty good, man.
Yeah.
I mean, it breaks things down really simply. The books are like,
Yeah.
maybe like a finger's width thick,
Exactly.
and really easy. It's all like in little case vignettes, so really easy to digest.
Yeah, there you go. And like you said, it dumps it down. Like for me, you need to dumb it down for me, and that's what you did for me. Just dump it down. Exactly what I need. Now, the other question bank that I used was a Welsh Kidney Club. They've got, I think, 60 questions in there. So look at Welsh Kidney Club. They've got a couple of questions. Now, but the thing that you have to, the thing that really helped and really the kind of the money question bank was the word. The one that you should use is ESENeph. ESN, sorry, not ESENeph. ESN, so the American Association of Nephrology. So they've got KSAP, Kidney Self-Assessment Program, and NEFSAP. And I put it up here because I couldn't remember which one. I think it was KSAP that you had to log on. That KSAP, which has a database of, they call it issues, but issues of questions, and each issue had like 50 to 60 questions. And in order to access that, you have to sign up for a membership with ESN. And I think if you sign up with your work email, you get it for free. So and they are about KSAP. So this is my KSAP. So you can see there were several issues: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Roughly 10, and each one. So this one had 74 questions, 75 questions. So you have, easily 500 questions in KSAP itself that will be. Oh, I'm going to do this. And that's all the questions you need to do. And the thing about the KSAP questions is that they are pitched much harder. They're at least maybe 3 times harder than the exam questions. So they're actually much harder. And I say do them because all the other question banks, like study PRN, on examination, they're way too easy. They're not representative of the exam itself. They're way too easy. So I wouldn't really bother with them. I would rather you spend your time doing these questions. You can do the study PRN. Like if you finish doing these questions and you just want some memory jog, to kind of, just do some questions. Yeah, you can do study PRN on examination. But I would highly recommend that you do these because the on examination ones, BMJ on examination, that kind of looks too easy. Like questions were not represented. So in terms of question banks, just 3. I say just 3. It's 3 big question banks. So there is the Nephro Shots, KSAP, and Welsh Kidney Club. If you do them, you'll be fine. Cool. Right. Fine. Finally, question bank. Oh dear. Forgot to transfer it. It was on my other computer. Give me 2 seconds. Let me just get it up. Ask me any questions or anything that you guys want to ask whilst I'm doing this.
So is this sort of, I'll call it a mind map for lack of a better phrase, but are you going to give this to us just to sort of jog our attentions?
Sorry, the mind map. Sorry, do you want to see the mind map?
No, just whatever we're scrolling through at the moment, this PDF or big page.
Are you what the one that I'm just? Is it moving or is it frozen?
Yeah, it's moving.
Oh, so what was the question? What was the question again? Sorry.
Can we have it?
Oh yeah, sure. I mean, this is a page that I made on my notebook. You know, that I just scroll through. But yeah, you're more than happy to. Again, hopefully I press record, so I can send this this lecture onto our group. So yeah, but definitely you can have this. The only thing is that because it's difficult for me to put this into a PDF because this page is equivalent to 10 A4 size, and it's difficult for me to sort of condense it into one page. What I might do is I'll try to see if I can make it into a link and share it with you guys. Sorry, bear with me. Let me just get these questions up. I created it before I came home, and I forgot to send it to my. There we go. ESENeph sample questions, and I forgot to send it to my email. I created it on my laptop, and I'm using my CPU just now. So I need to send myself. Is everything that I said, was that something, is that kind of what you expected? Was it a bit more than you expected? Kind of what you expected or a bit less? What are you guys thinking?
I thought it was really useful, so thanks very much. Some of these resources have been flagged before, but to like break it down by each section like that is really helpful. So thanks for taking the time.
No worries, no worries. But is this kind of what you expected in terms of, you know, oh, if this is the amount of work I have to do, or this is actually less than the amount of work that I have to do, that kind of thing?
I think it's maybe what I expected in terms of the amount of work. I think it's reassuring to hear how clinical focused it is. Obviously, we've just talked about the pathology bit, but it feels a bit more doable when you're talking about the focus being on guidelines and all of these other things. But all of those resources are so helpful. Just to echo what Chris has said. Thanks, Sal.
Yeah, no worries. Cool. Let me share.
Sorry. So I guess the only thing I was going to say was I remember Kirsty Crowe telling me like a year and a half ago, or whenever she'd done it a couple of years ago, that there was actually lots of pathology questions. Are you saying that there were only maybe 4 or 5 pathology slides?
I think it depends. So the year that I did it the same year as Kirsty. No, I did it a different year from Kirsty actually. So the first year when I did it, there were probably 6 pathology slides. 6 or 7, because it comes up on your 6 or 7 pathology slides that I can remember. And the second time I did it, similar, 6 or 7, maybe even less, maybe 5 to 7 if I didn't remember wrongly. So it's not overwhelming amount, but it's still enough that can cause a pass or fail if you, well, like me, 419 marks, and that could help me pass. And any other questions?